Now recording.
Hello, everyone, and good morning. My name is Janelle Marzai. I'm the healthcare facilitator at UCSB. Thank you for joining us for the overview of Open Enrollment 2023. Open enrollment begins Thursday, October 27th at 8 a.m. Pacific Standard Time and ends Friday, November 18th at 5 p.m. Pacific Standard Time. During open enrollment, this is the time to make changes. You can make changes or enroll in a medical, dental, or vision plan. Add eligible family members and medical, dental, vision, or legal. You can enroll in your health and or dependent care FSA. You must re-enroll each year. You can start or change contribution to your HSA account and learn more about our plans. Reminder, if you do not wish to make any changes, you do not need to take action. Except for the health and or dependent FSA, you must enroll each year. Your current insurance coverage will continue, but your costs may change. All medical plans continue in 2023, no changes to our current medical plan selection. For 2023, there is a pay band increase. The pay band threshold adjusted each year based on the Consumer Price Index from California Department of Finance Index for urban wage earners and clerical workers. Definition of range for 2023 medical contribution base using full-time salary as of January 2022. I don't think someone's muted. Please mute yourself. Thank you. Changes in employee rates for 2023. This chart provides you the contribution increases for each plan year. Employee contribution increases are less than $14 for Kaiser and UC Health Savings Plan. Employee contribution increases for UC Care range from $27 to $87, and for UC Blue and Gold, $15 to $46. Also notate rates subject to collective bargaining unit agreements. Here's the new chart for 2023 employee contribution. This chart will provide you the monthly deductions that's based on your pay band. EE stands for self, EE plus C stands for self and child, EE plus SP stands for self and spouse, and EE plus FAM stands for self and family. There is a $0 employee premium contribution for core plan. These deductions are pre-tax contributions. Oh, go ahead, Lisa.
Thank you, Janelle. I just wanted to point out for everybody, this is probably going to be where we have the biggest activity around, and that is the significant increase in premiums. So we recognize it is significant. It's more than what we've experienced in the last few years. And I'll just say that, you know, the rising cost of health insurance and the rising cost of medical treatments has exacerbated over the last 2 years because of COVID. And so some of these increases that you're seeing is across, you know, other industries. That's not just UC. We usually do a very, very good job of negotiating our rates. But this was a year where it was notably higher in terms of the factors that influenced medical costs because of the pandemic, and just higher utilization overall, which always will impact the premiums. So we recognize that this is going to be significant for a lot of folks. And you know, we're here to help navigate those conversations. If you have people that are very concerned about what that increase might look like to their overall income. Thank you.
Okay. What's new? Enhanced fertility benefits for 2023. Currently, UC Care, Core, and Health Savings Plans covers only diagnosis of cause of infertility at 20% coinsurance. Starting in 2023, coverage for IVF, GIFT, ZIFT will be covered up to 2 treatment cycle lifetime limit at 50% coinsurance. Starting in 2023 for UC Care Core and Health Savings Plan, Anthem Health Guide will be replaced by Accolade. Accolade will provide additional support to the healthcare facilitators, and it will be another resource for you. Furthermore, there will be some overlap with healthcare facilitators like claim resolution and answering benefit questions. However, we are both available to support your inquiries and your needs. Accolade will have a UC dedicated phone number, mobile app, member portal, and it will provide virtual medical care questions, psychology care, second opinion, and clinical support. UCHealthPlans.com is to replace UCPPOplans.com. Accolade is brand new and will be navigating the new vendor just like you. We would love to hear your feedback and your experience when you work with Accolade. All right, HealthNet PPO changes. The Blue and Gold plan currently, the diagnosis of infertility is covered at 50% coinsurance. Beginning in 2023, enhanced infertility benefits such as IVF, GIFT, ZIFT will be covered at 50% coinsurance up to 2 lifetime cycle limits. For Kaiser Plan HMO, in 2023, enhanced infertility benefits will cover IVF, GIFT, ZIFT at 50% coinsurance up to 2 lifetime cycle limits. Currently in 2022, the diagnosis and treatment of infertility and artificial insemination is 50% coinsurance. Starting in 2023, the diagnosis and treatment of infertility will be categorized as outpatient imaging, lab, and other diagnostic treatment services, which will be at no cost share. Also beginning in 2023, Kaiser HMO will now cover male condoms, breastfeeding supplies, and breastfeeding services like lactation support at no charge. For Kaiser, starting in 2023, outpatient mental health services for intensive outpatient program, partial hospitalization, intensive applied behavioral analysis, ABA program for autism, and substance use disorder for intensive outpatient program and methadone maintenance program will have no cost share. Kaiser Behavioral Health is provided by Optum. There will be some new enhancements like virtual behavioral coaching program, which is an 8-week self program. It helps manage symptoms of depression, stress, anxiety, coaching, assigned for weekly one-on-ones and sessions, and online scheduling will be available. Also, Sanville CBT app will transition to self-care app by Able 2 on 1/1/2024. This app provides tools and techniques based on CBT concepts and mindfulness and has weekly assessments, daily mood tracking, skill building, and other content. Okay, questions? Let's see.
I will say, I know there's a lot here with Kaiser. Just keep in mind that that is a restricted area. You have to, live in that service area for Kaiser. So we don't have a lot of people in Kaiser because of the service area that you have to live in. So just kind of keep that in mind as you are answering questions for your employees. Some of the enhancements for Kaiser might look really appealing, and they are. But the Kaiser itself is not available to a lot of us. So just keep that in mind. And a question about GIFT, ZIFT. So the acronym explanations are on the slide, but Janelle, I know you know that one by heart just because you've had to read these slides for so much this last few days. Can you just share real quickly what ZIFT is?
Sure. ZIFT is zygote intrafallopian tube transfer, and GIFT is gamete intrafallopian tube transfer. It's part of the process when you're doing IVF, when you're transferring your eggs.
Can you say that 3 times really fast?
I don't think so. Third. Okay. Any more questions, or should we continue?
Let's see. Oh, here's one that came in. Can you explain how someone calculates their income band to determine their benefits premium? That's a good question. So the income bands, so Janelle, if you could go back to that slide just really quickly, is based on your income as of January 1. So your premiums for 2023 are based on your income as of January 1, 2022.
Oh, this one, okay.
Yeah. So base medical contribution base is using full-time salary as of January 2022. So first you have to know what band you're in. And then depending on what band you're in, then you go to the medical rates and you look at the rates specific to those different bands. So you would be looking at what was your annual salary as of January 1, 2022. And you'd be looking at the 2023 salary bands. Can you go back one slide, Janelle? One more. Can you go back? Yeah. So even though it's based on January 1, 2022, you're looking at this column, the 2023, right? So let's say you made $62,000 as of January 1, 2022. Under 2023, band 1 is 65,000 or under. So you would be in salary band 1 for 2023. And no, we do not have a cost chart for the different unions. Those aren't published all in one document because each union is doing something very different. So that's navigating that a little bit differently for unions. The union contract states what the union has bargained in terms of benefits. So we really do encourage folks to go to the union contract and look to see what it says about benefit premiums and what's been negotiated. And then we can, at that point, help people navigate what that means. But they all do something a little different, and so it's not as easy to just create some sort of a matrix on. Okay. Thank you, Janelle.
Okay. Okay. For Delta Dental PPO plan, cone beam CT imaging has been added to our benefit plan. It will be paid at 100% for in-network providers. UC will continue to pay 100% of the costs for employees and retirees eligible for the full UC contribution. For Delta Dental HMO plan, there are no changes to your benefits. For our vision plan VSP, there are no benefit changes for active employees. For our non-medical plans, there will be no benefit or rate changes to our supplemental health plan. Enrollment is now available on UC Path for AFLACT. For disability, Lincoln Financial Group, there will be a 7.5% rate increase for short-term disability only. Disability is not open during open enrollment. There are no rate changes for legal. However, there are some enhancements, which are listed here on this slide. For life, AD&D, there are no benefit changes or rate changes. UC Health Saving Plan will have an increased cost for our in-network deductibles. $1,500 for individual, which is about $100 increase from 2022, and $3,000 for family coverage, which is a $200 increase from 2022. No changes to the out-of-network deductibles. Health Equity continues as the custodian for UC HSAs. In 2023, there will be an increase for HSA contribution, $3,850 for individual coverage, and $7,750 for family coverage. Catch-up contribution for members 55 years or older remains the same at $1,000. UC contribution also remains the same, $500 for single and up to $1,000 for family coverage. Okay, flexible spending accounts. The contribution limit has increased to $2,850, which is about a $100 increase from 2022. The Health FSA carryover limit is $570 from 2022 to 2023 plan year. 2023 dependent care FSA contribution is $5,000 for non-highly compensated employees and $3,000 for high compensated employees, which is defined by the IRS. So 2021 plan year debt grace period extension. There is no carryover feature. Debt care grace over period. This means that unused funds contributed in 2021 plan year can be used for reimbursement of claims incurred in calendar years in 2021 and 2022, as long as your account is active by December 31st, 2021. The deadline for submitting claims is January 31st, 2023. For those of you who have debt care, please notate these filing dates. So new for 2023, limited purpose flexible spending account. The limited purpose flexible spending account is a pre-tax benefit used to pay for eligible dental, vision care, and post-deductible medical expenses for participants enrolled in the high deductible plan. The LPFSA is similar to the regular healthcare FSA, but is designed to work in conjunction with your health savings account. Here are some of the limited purpose flexible spending account facts. LPFSA account will be created for eligible employees automatically, which means employees do not need to enroll and can't opt out. Balance of the Health FSA that is eligible for carryover is up to $570, which will be placed in the LPFSA. Contributions are limited to the Health FSA balance. The participants may not contribute additional funds. Generally, eligible expenses are restricted to dental, vision, and preventative care services. Participation is limited to 1 year. Employee may not re-enroll in the LPFSA for a subsequent plan year. Any remaining balance in the LPFSA at the end of the runout period for the plan year is forfeited. Please check out the open enrollment website for more content and resources. If you have any open enrollment questions, please open a service ticket now under Employee Services, Benefit Administration, Open Enrollment Questions. To make any updates or changes to open enrollment, please visit UCPath to submit your open enrollment changes. Here's the upcoming communication announcements for open enrollment 2023. October 19th, everyone should have received the open enrollment booklets, which were mailed out. The week of October 24th, the 2023 open enrollment website will have highlights and changes. The Alex link will be available and the plan chooser tool. October 27th is when open enrollment begins. There will be a UC announcement. November 9th, UCNet will have an open enrollment reminder for those of you who did not enroll yet. And November 14th will be the final reminder. Open enrollment ends November 18th. Yes, Lisa.
So I just wanted to to circle back on these mailings. So the cutoff is September 28th. So if any of you have a new employee who started after September 28th, they are not going to get a mailing. So you would want to make sure that you identify any of your new employees after September 28th and let them know that the booklets are online. And so they can access the booklets online for their open enrollment. So just circle back with some of your new folks because they're not going to get that mailing. And then the other thing, just as a reminder, so these are UCNet reminders, which are on the website. I will be sending out an open enrollment, launching open enrollment, hopefully later today, announcing that to the campus. And then please remind your employees that the UC Path, when you log into UC Path, your dashboard will also have a banner about open enrollment, and it actually tracks how many days are left of open enrollment. So as you know, over the last couple of years, UC Path has been able to send out more communication directly to employees system-wide related to a lot of different types of communication. And one of them is, trying to get more information out directly via email through the UC Path system. So just, keep that in mind, that there are different ways and different venues that employees should be receiving information about open enrollment. And we will send out a reminder after that reminder on UCNet goes out. I'll send out a campus communication reminding people to do their open enrollment if they haven't done it yet. And just remember, last year was our first year where the dates were compressed. So we lost a few days of open enrollment days. Last year was our first year where it ended on Friday instead of the following Tuesday. So we're still sticking to that Friday. So just remember, it's it's a little bit shorter period. And we want to make sure that people understand that and they do what they need to do. Okay. Thank you, Janelle.
You're welcome. Thank you, Lisa. Okay, this year UC will be hosting a virtual benefits V-Fair. Please join us at the UC system-wide virtual benefits V-Fair on October 24th, 2022 to learn more about the 2023 benefit changes and enhancements. The V-Fairs will be open until the last day of open enrollment, which will be November 18th. Stop by our UCSB virtual booth. Please gain insight on what's happening during open enrollment and how the changes to benefits could impact you and your family. Also, you can check out other campuses' booths and vendor booths. And this is a little snippet of what our UCSB booth looks like. And we'll be hosting 2 medical plan comparison webinars on November 2nd at 9 a.m. and November 10th at 3 p.m. If you're not able to attend these webinars, we will have the recordings listed on our HR website and Healthcare Facilitator YouTube channel. If you need help choosing a plan, Alex is your 24/7 personal benefit coach that helps you find a plan that best fits your needs. It's available in English and Spanish. This flyer is a good resource. It's available on our HR website. It has all the links you need to learn more about your benefits. Hi, Lisa?
I think I ever put it back down, but I will just comment on this. So the medical plan comparisons, again, is super, super helpful for any of you or your employees who are considering changing their medical plan. If they're happy with what they have, then they just, obviously they need to be aware of the premium cost difference that they will be paying for 2023. But because all of our plan costs are going up, it's not necessarily a matter of well, if I go from the blue and gold plan to the UC Care plan, I'm going to pay less. Well, you're actually not going to pay less. So some people might just stay where they're at, even though there's some significant premium cost changes. But if they're considering, they really need to attend one of the medical plan comparisons. It is where we get into a lot of detail about the differences between the plans in different types of scenarios in terms of medical treatment. That Janelle is going to record one of them, so it will be available on an ad hoc basis for anybody who would like to access it. They'll have access to it. They can go back and look at a certain section if they need to. But I will say that those are the most valuable presentations, I think, because it really does go into a deep dive about the medical plans. And of course, it covers the behavioral health as well for the different plans. So just keep that in mind. And then the virtual fair, it's an opportunity to, talk to vendors. There's some chat features there. They've done a really, really good job with the virtual fair. So I highly recommend folks participating and seeing if they can get their questions answered. There's, all the vendors are there. So if they have a question about the legal plan, they can talk to somebody from the legal plan. There's the medical vendors. So dental, legal, vision. So it's a great opportunity. It's opened as of Monday. Today's Wednesday already.
Yes.
I mean, it's open until the end of open enrollment.
Correct.
So it's another resource, and we really want to start to encourage our employees to access all of these resources. So different types of resources. We all learn differently. We all need different. We want to read the booklets. Some people want to participate in a live presentation. Some people would rather listen to something on their own. Meet Alex. We launched this last year and it was very successful. And they've done some enhancements to Alex. So it's even, I think, more accurate than it was before in terms of how it helps people navigate choices. So lots of different ways for people to learn. And so I would ask you all to encourage your employees to not only participate, but give them some time to do so. I know how busy we all are, and it's stressful to try to fit in time to learn about open enrollment, but these are the benefits that people come here for. And so we want to make sure that we are giving them the support and the time to participate in some of these events and learning opportunities. So thank you.
And that's all. Thank you so much for joining us. I think we'll answer questions. I don't see any new ones. Do you know which of these health insurances are supported by UCLA health centers? Our PPO plan, Anthem.
So here's another one. Can you enroll in short-term disability during open enrollment? No, but it's a great question. If you're not enrolled in voluntary short-term disability and you'd like to enroll, you need to go through a statement of health to enroll in the short-term disability. So basically, you can initiate that at any time through a statement of health, and then the insurance company determines whether or not they will insure you.
My question is actually, can you unenroll if I am in short-term disability and want to cancel it?
Oh,
Can
I'm
I do
sorry,
that?
Greta.
That's okay. That's okay.
You can, yes, you can cancel your disability insurance. It doesn't have, it's not an open enrollment action. So you're not going to find it if you go to the open enrollment button.
Okay.
But it's through UC Path, and it would be, just a cancellation of insurance.
Okay, thank you.
You're welcome. And they're asking to go back to the virtual fair link. That is also on the flyer. Right, Janelle?
Yes, it's on the flyer, and then I did go back to the link for the virtual benefit fair.
Okay.
I don't know if you can see it.
Yeah, it's
Okay, okay, just making sure. Yes, and it is available on our HR website.
So you can go to the HR web, and the flyer is an independent document on our HR website. So if you wanted to just click on that flyer, those are all live links, correct, Janelle?
Yes.
Yeah. Yeah, so that's another great resource to send to any of your employees. If they're not quite sure like how to navigate what's available in terms of resources and what presentations are going to be, just send them the link to that flyer. And a lot of good information is on there for them to determine how they want to navigate this open enrollment. Okay, so we have some questions here.
Kim's question. If represented employees want to know about their premium costs, that will show once open enrollment is open and PATH, or is there something they can get from their union?
So what I don't know is when you go into UC Path to do your open enrollment, we have to find this out, is as a represented employee, if you went in and you looked at what your benefits are, and let's say you say, oh, I'm going to switch to UC Care, and you enroll in that, you haven't hit confirm or anything. What I don't know is if the premiums connected to your union will appear there. That's something that we have to find out, what's programmed in UC Path to help people navigate the premiums, or if it's completely outside of the system at this point. So we need to do a little bit more research on what UC Path is able to do in the open enrollment application. Let's see. So there's one about dependents. One of my children turns 26 in January. Does she fall off my family plan, or do I need to do anything to ensure she is no longer on my plan? Cynthia, I'm going to let you answer that one. I think it's automatic, but
Yeah, so your 26-year-old Janice will drop off as of February 1. So last day of coverage is January 31, 2023. If your child is the last one and you have just yourself or a spouse, then you might want to look at your accidental death and dismemberment, dependent life insurance, because those are not automatic, and you'll need to submit a form to change that coverage.
Great, thank you.
You're welcome.
yeah. And I'll just add one more thing to that. Your premiums will change if that's the last child. If you have other children on your plan, then you wouldn't see a medical plan premium change because there's other children on there. But you should see a change if that's the last child, because you'd be going from family coverage to a different coverage level.
Thank you, Lisa.
Mm-hmm. I remembered one piece, but I didn't remember all the other stuff, Cynthia, that you just mentioned. So we're a good team.
Yeah.
Okay, so Nicole wants to talk more about the LPSA account. It sounded like it is only if you have another plan or account. So Janelle, you want to go back to that, and let's see if we can't clarify who is eligible for that.
Yes. So in order to be eligible, you need to participate in a health FSA during a plan year, have a carryover balance greater than $25 at the end of that plan year. And you're enrolled in a health savings plan for the following year.
So Janelle and Cynthia, maybe you can, if you know this too. So participated in a health FSA during a plan year. Does that mean I would have had to have participated in 2022? Or what if I participated in 2021, but I didn't participate in 2022? Does that still apply?
That's a good question, because there's the carryover, but the rules for that. But I think the language says that you must have been enrolled in FSA in 2022,
Okay,
switching to the health savings account in 2023.
okay.
Is that what you think, Janelle?
Yes,
Okay.
I agree, Cynthia. Thank you.
Okay, so you have to have been in the FSA in 2022, and you've decided you want to enroll. Let's say you're in blue and gold in 2022, and you now want to enroll in the UC Health Savings Plan, and you know you're going to have some sort of a carry forward of your FSA from 2022, and you can't enroll in the FSA and be in the UC Health Savings Plan. And therefore, this is new because it allows you to carry over your FSA and use it. Right? So, okay,
Yes, yes.
Yes.
okay.
Thank you.
I was channeling Nicole because Nicole always has really good questions. So I was channeling you, Nicole.
Thanks, Lisa.
Did that help, Nicole, kind of clarify?
Yes, it did. Thank you so much.
Okay, good. All right, let's see.
We have a question from Dean. If we change health plans, when does that go into effect? Will we receive information from the new insurance prior to the start date on how to book appointments, etc.?
Well, so open enrollment is effective January 1, 2023. So that's the effective date if you make a change. There are mailings if you change a plan. We don't have that timeline yet of when you would receive your new cards. That'll probably be something that we communicate a little bit later. We just had our training last week. So Janelle, I don't recall them saying when insurance cards were going to be mailed to new members.
No, we did not. We did not. They're going to receive new cards, but we did not get a date yet.
Okay, all right. So more information will come on what kind of information you will receive if you do change plans.
Yeah, some plans may not issue new cards, so that we might have to post which plans do or don't. But usually the plans will try to get the cards out by the late December to early January. That's their usual target goal. And they're usually working throughout the holidays to get this done.
Right. But if you actually change your medical plan, you would get
A new card, correct.
Right, right. And then how to book appointments. Well, once you're in a new plan, you would be scheduling an appointment, similar to how you would before. If you're changing to an HMO, then you need to have selected a primary care physician. That's the primary care physician that you need to schedule your appointment with. If you're in one of the PPO plans, then you don't have to stick to one doctor. You just have to look at who is a provider and schedule those appointments. We will say, and a lot of you know this already, it takes a long time to get an appointment sometimes. especially if it's a new appointment, meaning it's, it's a physical. It's the first time you're seeing that doctor. The scheduling right now is, 4 months out, sometimes 5 months out. So, it's good to get those on the books as early as you can, because we are in a community where we struggle with having enough providers, even in all of our plans, in order to get appointments, that are quite timely. So I wouldn't wait on those types of things.
So Hyacinth has a question, and I'm not too sure what you mean, Hyacinth, if you can explain which ones are not automatic drop-offs.
There was a question a couple people back about if someone has a 26-year-old, you said they automatically would be disenrolled from or unenrolled from their medical, but there were forms for accidental death and dismemberment. But was there something else besides that,
Yeah,
to take-
dependent. Yeah, I'm sorry, dependent life insurance.
Okay, thank you.
Mhm. Those are not automatic.
Thank you.
You're welcome. And then Kim has a question. Can you enroll or unenroll in the extra plans from Aflac anytime in the year, or just enroll during open enrollment?
I don't know. I thought those are yearly plans.
I think you can unenroll, but at any time via form. The enrollment part for new hires are done within the 31 days for enrolling, and during open enrollment. So mid-year enrollments for current employees have to wait until open enrollment. Does that make sense?
Okay. But if we're enrolled right now, we can cancel them at any time. Is that what you're saying?
Correct.
Okay.
By form.
By form. Okay. But if you want to enroll, it has to be a life event or open enrollment.
Correct. Thanks for that. That life event, I forgot.
Okay. All right. Let's see. Any more? All right. You guys always ask such great questions.
Okay, so Lisa has a question. Can you remind us of the max contribution levels for retirement plans for this year? I read recently in the news that these were going up.
I guess I'm not sure what you mean by maximum contributions for retirement. I mean, how much we contribute as an employee?
I guess both, like what can employees contribute to their retirement plans? And then what are the contributions from UC?
So are you talking about the pension, or are you talking about the voluntary retirement plans?
For me, voluntary.
Okay, so when we're talking about the 403B and the 457, I don't know off the top of my head what the tax maximum contributions are for 2023.
Okay.
Is
that also dealt with during open enrollment though?
No.
Oh,
it's-
okay.
Yeah, it's completely separate. So I'm not sure when they publish the new maximum contribution rates, but that would be on UCNet under retirement savings programs. They would typically publish them there. I just don't know how early they publish those.
Okay, thank you.
You're welcome.
Next question, what's the best way to find out if there are pharmacy coverage changes to this plan, the plans this year, Health Net Blue and Gold? The benefit summary information is listed, will be listed on UCNet, and it will be listed on the virtual VFairs. I know the vendor is still the same. There hasn't been any change as far as pharmacy for Health Net Blue and Gold. But if you want to learn more about the rates, I would look at, I could send you the summary of benefits, but it is also listed. It will be listed in tomorrow on UCNet, the benefit summary for HealthNet and VFairs.
Yeah, so June, so nothing's changing with the pharmacy vendors for any of our plans. So we're continuing with the same pharmacy vendors. So if they change anything in terms of their formulary list of drugs, Janelle, I don't know if that would come out as, you know, a significant change that we would be aware of during open enrollment. I think if it was something pretty significant, that would have been addressed, like, you know, these 5 generic drugs are no longer to be considered generic, and they're going to be, you know, a different cost. We would probably know about something pretty significant. So my understanding was there was nothing changing from the pharmacy level of the plans. But those would be good things to potentially follow up with if you go to the virtual fair, and just read through the open enrollment booklet to make sure that there isn't any sort of, you know, fine line about some sort of a formulary. But I didn't hear anything significantly changing at all.
Yes, me either.
Thanks, Lisa and Janelle.
Thank you. Great. Thank you, Cynthia, for sending those links.
And Matthew sent the other one. Looks like New York Times article.
All right. I don't see anything else coming through. We're going to end quite early, which is time back for you all. If you have any other questions, you can submit them through ServiceNow. You know, we have a team of mighty two, Cynthia and Janelle, helping to manage those open enrollment questions. So it's best if you can put them through the ServiceNow, because we can triage easier depending on people's work volume, as opposed to doing individual emails. It just makes it harder for us to stay on top of those. So thank you all for coming. Really appreciate your participation. I always look forward to seeing all of you. Hopefully you all got to see some people that you hadn't seen in a while. And again, I have a lot of gratitude for what you do in the departments. I know it's been very, very difficult couple years, and dealing with a lot of staffing vacancies. I know you all are doing double duty, and I just have so much appreciation and gratitude for all of your hard work and how much you take care of each other and the folks in your department. So thank you. You're wonderful partners, and whatever we can do here in HR to help support you, we are here to do that. So thank you, and have a good rest of your week.
Thank you, everybody, for joining us.
Thank you.